Yes, good evening once again. Thank you so much for sparing time to be with me here. My name is Rodney Mutunji, and I'll be taking you through WASH. And today we shall pick up from where we stopped last time, where we introduced WASH. We talked about the global significance, we talked about the African and sub Saharan significance, and how it is right now. And we also highlighted on the wash in South Sudan. But today we want to dive into that more. We want to dive into more about wash or water sanitation and hygiene in South Sudan. But first, we need to acquaint ourselves with a few facts here about South Sudan. Population is about 12 million, and its capital is Juba, where they speak English, Arabic, and over 60 indigenous languages in South Sudan. It gained independence on 9th of July 2011, and that makes it the youngest state in the world. But when we look at WASH of South Sudan, we see numbers that might not uh, really appease us, and that's why we are coming in to educate ourselves and get acquainted with knowledge of how to change the status quo as far as wash is concerned. So, first of all, we look at water access in South Sudan. Only 28% of the population has access to safe drinking water, meaning if you're in a group of 10 people, about three of you can safely say that they have access to safe drinking water, which is not a desirable number, really. And 80% of the water sources in South Sudan are contaminated. These could be contaminated with these causing agents, they could be contaminated with heavy metals, as we shall see what can contaminate the water, especially in South Sudan. Then waterborne diseases are leading cause of death in South Sudan, and this is because of having undesirable wash practices. Then, when we go to sanitation, we realize that only 7% of the population has access to improved sanitation facilities. Because these include toilets that can prevent interaction between feces or human excreta with people. Then the fact that open defecation is also still common, especially in rural areas, makes the sanitation situation in South Sudan far from being that desirable. And we also lack access to sanitation facilities, and this contributes to the spread of diseases. Then, about hygiene, there are still poor hygiene practices, especially in rural areas. We also have only 10% that can access basic hygiene services like hand washing, good menstrual hygiene, especially among the ladies. So basically, if you're in a group of 10 people, maybe on the street or in class or anywhere where you could find 10 people, meaning that only one of you has access to that basic hygiene services. So it is also a very undesirable number, and we shall look at how to correct this collectively as public health specialists and have a better situation in South Sudan. So, lack of access to hygiene services contributes to the spread of diseases. Uh, Many diseases can arise from this, including fecal oral diseases, respiratory tract diseases, due to not washing hands at critical points, like we mentioned in the first session, where we talked about washing hands before preparing food, before serving it, after visiting the toilet, and after washing or bathing a baby. So you need to wash your hands with soap and water for you to achieve good hygiene. So the impact of all this power wash that is in South Sudan is that we have a lot of diseases that are spread. For example, diarrhea, cholera, and typhoid, and also it lack of access to safe drinking water contributes to malnutrition, especially in children. So this can be an effect on both the children not having enough food or the required food that will need water to be prepared, but it can also go to the mothers of these children not having enough food because the water is not adequate or it is not safe, you know. So when they are not feeding well, ultimately they will not feed their children, especially these who are still breastfeeding. They will not breastfeed very well. So the lack of access to this safe drinking water is uh, is a major cause of malnutrition, especially in children. Then children, especially those under 5 years, really die a lot due to poor sanitation and hygiene practices. Very high mortality rates in that age group because of unsafe wash in South Sudan. And our beloved country is also prone to natural disasters such as floods and droughts. So these are emergency situations that really always require our attention as public health specialists because they destabilize the existing wash facilities, and they also cause a lot of competition for those in places where the floods or the drought is not, and people have shifted to those places. So wash is always crucial in these emergencies to prevent the spread of diseases and ensure that there is health and well-being of affected communities. Remember, even with these floods, the normal drainage system is also disturbed. Okay, the existing public health facilities, for example, the sanitation facilities like toilets, can also be destroyed. So people might resort to other means which might not be good to maintain good wash. Then emergency wash interventions include providing safe drinking water, sanitation facilities, for example, improved pit latrines, hygiene promotion activities, where we look at promoting hand washing at critical points, like we talked about earlier on, where we look at encouraging ladies to observe good hygiene during their menstrual period. So all these can be promoted during the emergencies. So we also have to interest ourselves with wash in schools. Schools being places that gather many people, the wash facilities or the water, sanitation, and hygiene facilities are prone to being uh, mismanaged, to being inadequate. Yeah. So in South Sudan, we are still having issues there. We lack access to school wash facilities that are needed, and this contributes to poor attendance and low education attainment. Like we said in our first session, proper wash or safe wash gives everyone dignity. So when you achieve that dignity, you're able to attend your classes without any disturbance. You're free to join with other people. But when you know that we don't have toilets at school, our toilets are not distinguishing between male and females. They don't have facilities where we can dump or we can dispose of our used pads, for especially in ladies. So all that contributes to these students or pupils going to school, attending these schools poorly, because they do not feel safe at those schools which have unsafe wash facilities. So, wash in schools includes access to safe drinking water. The water that is served or availed to these students or pupils in school should be safe for drinking, should be free from disease causing agents, heavy metals, and other water contaminants like we are about to see. Then sanitation facilities should also be in place, should be uh, improved, very improved pit latrines, and we should also have hygiene promotion activities like we talked about earlier, hand washing, water and soap, then menstrual hygiene facilities. So, wash in schools improves health and well being of students, especially girls who are often absent during menstruation due to lack of sanitation facilities. Yeah, there should these facilities of sanitation in schools should make sure that should provide uh, good conditions that enable girls to change their menstrual towels and feel free whenever they are doing that. Okay, yeah. So, but this is not always the case in sub-Saharan Africa. In many countries, and South Sudan is no distinction. Wash in health facilities is also very important because we go to health facilities or hospitals to get well, but when wash is not up to the standard, we go to these facilities to get well, but we end up being worse. So, lack of access to wash facilities or services in health facilities contributes to the spread of healthcare associated infections, and these are the ones which are famously called nosocomial infections. So, you might go to the hospital suffering from malaria, and instead of getting cured of malaria and going back home when you're free of any disease, you go to that, you come back with another disease. Okay, so you've gone to this health facility or clinic with only malaria, but because their wash or the water sanitation and hygiene facilities or services were not good, you end up getting another disease like cholera. Okay, yeah, so there should be services of wash that are up to the standard in these health facilities. And as public health specialists need to take keen interest in all this, we need to make sure that these health facilities have these proper hand washing facilities, sanitation facilities like good toilets and latrines, and there is adequate water to make sure that all those are running very smoothly. So, wash in health facilities includes access to safe drinking water, sanitation facilities like we talked about, and hygiene promotion activities. It improves the quality of healthcare services and reduces the risk of those nosocomial infections or the healthcare associated infections, the ones that you go to the hospital without but pick up from the hospital due to this unsafe wash being practiced over there. Then, when we go to communities, we realize that community based interventions include construction of water sources, sanitation facilities, and hygiene promotion activities. So they are almost similar to other places that we have been talking about. But one of the key and very essential points in communities is that you have to involve them. You have to involve them in every step of your intervention, in every step of your wash activity. The community members should be involved, starting from their leaders. Those are the cultural leaders, the religious leaders, their political leaders should be involved in everything. When you're constructing water sources, they should be involved. When you're putting up sanitation facilities, they should be involved. And when you're preaching the gospel of good hygiene and promoting better behavior as far as hygiene is concerned, you should involve them. Because when you involve them, you gain their trust. They know that what you're doing is for their own good. They also accept what you're doing, then they are able to own what you're they are able to own what you're bringing to them, so that it can last the test of time, so that it can be sustainable. So when you bring something to the community, when you provide for them safe drinking water through a borehole, you don't want it to break down and then they have to call you or leave it there. You want them to own that bond, so that when it breaks down, they take that initiative to mend it or to repair it, to fundraise and make sure that their borehole is working. And this is only possible when you involve them in everything. Identify what they need by involving them. When you involve them, you get you get to appreciate the context of that community, because you don't want to bring something, or you don't want to provide them something in wash that they do not want. Okay, you don't want to construct for this community maybe pit latrines when for them they prefer to use aqua privies like we are going to see, or they prefer to dump their excreta in ditches and then they cover. So you have to involve them. Even when you want to change their behavior, make them understand why it is better for them to change. Let them be the ones to initiate that change, okay? Not you forcing them onto that change. So community involvement is one of the key points in WASH when it comes to communities. So WASH in communities improves health and well-being of community members and contributes to the overall development of the community. So when they are well, of course they will be productive, and when they are productive, this improves the overall community. Then WASH also plays a very big role in agriculture. And we all know that agriculture is the backbone of South Sudan's economy, and WASH is very crucial in this agricultural productivity. Without adequate water for irrigation, especially during the dry spells, then you cannot achieve success in agriculture. Okay, but we also need sanitation facilities for farm workers. We don't need these farm workers to be defecating in the fields, because we want to cut off what we saw in the F diagram, that uh, when you don't prevent, when you don't construct sanitation facilities, then this human excreta gets to the plants in the fields. And when it gets to the plants in the fields, it can be transmitted to the person who is going to eat this plant, or this food that has been gotten from this plant. So we don't want that. That is why we are encouraging sanitation facilities for farm workers and practicing hygiene at those critical points. Washing your hands with soap and water should be very, very essential for these people working in agriculture, because washing agriculture improves food security and livelihood. So when they have adequate water, when they are well and not sick of these fecal oral diseases, they are able to produce more food throughout the year, and this improves their livelihoods, because they are able to sell and get money from this food throughout the year. So because South Sudan is developing, and it is on the rise, there is this predicament of rapid urbanization, which has led to poor sanitation and inadequate access to safe drinking water. So what happens is that all people want to go to town because they believe that's where the opportunities are. Okay, but in this strive to go to town, they end up getting to places which do not have good sanitation. You find you're in a place, but they don't have adequate sanitation facilities like toilets. Okay, so these people end up congesting in maybe another or a neighbor's toilet, which gets full very fast, and then now problems arise. Okay, we tend to spread a lot of diseases due to this competition. Okay, yeah, and this is all coming from this urbanization that is not being controlled. It is not planned. Okay, we do not have a structure for our urban areas, and this is all over sub-Saharan Africa. You find the drainage systems are not well, so meaning when you have uh, storms coming, these areas are prone to being flooded. And when flooding comes, of course, everything now becomes worse as far as wash is concerned. Surface water is contaminated. Some sanitation facilities are damaged, and people resort to other means of excreting or disposing of their human excreta, and these can hamper good wash and lead to a spread of a lot of diseases. So all this is because of rapid urbanization. Uh, but the good news is that we are having a lot of non-government organizations, the government itself, and all the other partners realizing that for us to have a good country that moves forward, WASH should be given the attention that it deserves. So there is a lot of work going on from the NGOs, from government, and other partners, like you will see. And one of the key organizations that is taking keen interest in WASH is UNICEF. So UNICEF is a United Nations organization, but which really focuses on improving the health of children and their well-being. But most children are part of the community. They originate from us, the big people, or or their parents. So you cannot only have children taken care of and you leave the other people. So UNICEF doesn't only focus on the children, but also the community around them. So it provides technical and financial support to the government and other partners for wash interventions in South Sudan. And their focus is really on providing safe water sources, constructing latrines and hand washing stations, and promoting hygiene behavior change. So, this hygiene behavior change is majorly promoted through this communication through talk shows, radios, through community visits by community health workers. There are also those adverts on radio that promote this hygiene behavior change. So all this is supported by UNICEF, and it does this by making sure that it involves the community. It does this successfully by involving the community, and we talked about how crucial involvement of the community is for them to accept any intervention in WASH, for them to own and make sure that this intervention or this work that you're bringing to them uh, is sustainable. They have to be involved. So UNICEF takes very keen interest in involving the communities. But it is not alone. We have Oxfam also doing a great job by providing safe water sources, constructing latrines, also hand washing stations, and promoting hygiene behavior change, like we noted earlier. And it also makes sure that it involves the local communities and other partners. Because when you cannot do all this work alone, you cannot construct boreholes, teach communities how to wash their hands, and then also dig pit latrines for them. No, you cannot do this alone. So that's why they have to collaborate. All these uh, non-government organizations and the government itself, they collaborate together so that they can achieve a synergistic effect, so that the overall effect or their positive change is greater than when they are individually working. Okay, yeah, so they have to collaborate so that if one is focusing on the rural areas, another is focusing on the urban areas so that we can realize a bigger goal and a bigger achievement. We also have Water for South Sudan doing a very good job to drill boreholes and wells to provide access to safe drinking water in rural areas. It also provides hygiene and sanitation education, which is very essential in making sure that people leave their old and undesirable behavior to good and desirable behavior as far as wash is concerned. So it does that very well, and it focuses on rural areas. Action against hunger also does a very impeccable job of providing safe water sources, constructing latrines and hand washing stations, and promoting hygiene behavior change. Also does this successfully by involving the community so that their interventions are sustainable. Catholic Relief Services also engage in constructing latrines, providing safe water sources, and promoting hygiene behavior change. By involving the community, we have to keep on reminding ourselves how important it is. Very important thing to involve the community so that they can accept, they so that you can get their trust in what you're going to implement, so that they can sus- sustain that project or that work that you're bringing to them. So you have to involve the community in every step. World Vision does almost the same thing and also involves the community. Save the Children does almost the same thing of providing safe water sources, constructing latrines, especially during those emergencies of floods, of of people being displaced to other places, due to civil war, and also hand washing stations to promote good hygiene, and also promoting that behavior through communication of that is that enables them to change from the undesirable to the desirable wash practices. So Save the Children also works with community and other partners to ensure that these wash interventions that they bring are sustainable. Then we also have IRC, which is the International Rescue Refugee Council. The International Rescue Council is concerned with providing safe water sources, constructing latrines and hand washing stations, and promoting hygiene behavior change. Water Aid also does the same thing and makes sure that it involves the community and other partners. Then Samaritan's Pass is another organization that does a good job of constructing latrines, hand washing facilities, and promoting hygiene behavior change. So when you construct latrines, when you provide these hand washing stations, you must make sure that you also educate them to change their behavior from doing the undesirable of not washing hands, not using the toilets, or not using safe or not having safe water, to the desirable of drinking safe water from those safe water points, washing their hands with soap and water, and using the toilets correctly. Yeah, so promoting this hygiene behavior change is also very essential, as well as you are involving the community. Relief International does the same thing and involves the community. Global Water for Wash in South Sudan, it drills boreholes and wells to provide access to safe drinking water in rural areas, and also provides hygiene and sanitation education to communities. Then the World Health Organization does the same thing, and for it, it's more of supporting the government and other partners for this wash to be improved in South Sudan. Yeah. but it also involves the community to make sure that their interventions are sustainable. Then, when we look at the government and in specific the Ministry of Water Resources and Irrigation in South Sudan, for it is concerned with managing and regulating the water sector in South Sudan. So all the other NGOs that we have been looking at and those that we are about to look at, make sure that they liaise with this government entity so that their interventions can be accepted in the context of South Sudan. So the ministry collaborates with international organizations and partners to provide wash services and promote sustainable water resource management. Then the Red Cross uh, does provide safe water sources, constructs latrines during emergencies, and in those communities where there is open defecation. It also uh, avails hand washing stations and promotes hygiene behavior change. Does that by involving the community. Very important. Shouldn't forget that involvement of the community is very key. South Sudan Water and Sanitation Network. This is a coalition of the NGOs and the government agencies working to improve wash services in South Sudan and promotes information sharing and collaboration among the members of this network. Yeah, you need to collaborate for you to achieve a bigger goal. And this network that is called the South Sudan Water and Sanitation Network enables that to be successful. Then the South Sudan WASH cluster is the coordination mechanism for WASH interventions in South Sudan. So it brings together the UN agencies, NGOs, and government agencies to coordinate and harmonize WASH interventions and ensure that there is effective use of resources. Yeah, so all these NGOs, the government, and other agencies need to be working in unison because the goal is the same. Yeah, so one shouldn't be going backward when another is going forward. The goal is the same, just have to to harmonize positions and work together. Yeah, so if someone is going to drill boreholes and is drilling them in rural areas, you have a problem of rapid urbanization. Someone is also going to provide good sanitation facilities there. You have a problem of unsafe water in rural areas. Another one can provide for some rural areas, and another organization can provide for the others. Then another can deal in making research and monitoring and evaluating whether these interventions are working. So there should be that collaboration for us to achieve bigger results. Then there is also South Sudan Rural Water Supply and Sanitation Association, which is a non-government organization that works to improve access to water and sanitation services in the rural areas of South Sudan, sorry. So the organization provides technical assistance and support to communities to develop and maintain water supply and sanitation systems. Then the ICRC, which is the International Committee of the Red Cross, does the same that we have been talking about. Then we have the South Sudan National Water Policy, which provides a framework for managing and developing the water sector. And this policy recognizes the importance of wash and targets improving access to safe water and sanitation facilities. Yeah, it is a very important policy that that makes sure that wash is improved because of its importance in the national development. Then we have South Sudan Urban Wash Program, which aims at improving access to safe water for drinking and use in homes and sanitation facilities in urban areas. So this one focuses on improving wash in urban areas of South Sudan, and it provides infrastructure development, builds capacity of communities by mentoring them and improving their self-esteem and building their confidence to take charge of their wash and their health. So that is what we can talk about capacity building. And then it also uh, it also focuses on public and private partnerships to ensure that there is sustainability of these interventions. Then we have South Sudan Hygiene Promotion Strategy, which aims at promoting behavior change for improved hygiene practices. So, for you to achieve improved hygiene service practices, you have to leave your old behaviors and adapt to good behaviors as far as hygiene is concerned. And one of the organizations that that really do a good job in South Sudan on that is South Sudan Hygiene Promotion Strategy, and it emphasizes on involving the community and education to promote sustainable behavior change and improve health outcomes. Then we have the South Sudan CLTS program. Is community-led sanitation. It is community-led total sanitation, and we shall look at it in detail. But its major use and its focus is on eliminating open defecation. Yeah, so this South Sudan CLTS program really focuses on eliminating this open defecation, especially in rural areas of South Sudan, and it uses community mobilization and participatory approaches to promote behavior change and construction of sanitation facilities. Yeah, so in this CLTS, you make sure that it's the community that initiates the change, not you enforcing that change onto them. Then South Sudan Wash in Nutrition Strategy is the one that aims to improve nutrition outcomes by addressing the underlying causes of malnutrition, including poor wash services. So there are many causes of malnutrition, but wash is definitely or poor wash is definitely one of the major causes. So when you address that underlying cause, you're able to achieve uh, you're able to achieve a big step in driving out malnutrition. So this South Sudan wash nutrition strategy makes sure that it emphasizes the integration of this wash message with nutrition programs. So whenever they are delivering nutrition programs, they also talk about wash, and this increases the awareness of people about wash and its relevance in South Sudan. Then there is the wash financing strategy in South Sudan, which is is charged with mobilizing resources and improving the efficiency and the effectiveness of wash interventions. So for wash to be successful or wash services to be available, there should be adequate resources in terms of manpower or the technical people to put these in place, but also there should be financial uh, the finances should also be available, or, 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 or financing should also be adequate, because we realize that sometimes these wash interventions do not take cost because of lack of this financing. But Thank, we thank or we appreciate this South Sudan wash financing strategy because it is concerned with making sure that these resources are mobilized. Yeah, so they mobilize these resources and make sure that uh, these interventions are effective and efficient. Then it sets out a framework for allocating and managing wash funds and emphasizes the importance of sustainable financing mechanisms. So they know that for you to finance these interventions, you have to involve the community because, like we said earlier on, uh, for the community to own and embrace your intervention as far as wash is concerned, you have to involve them. So whenever you put up an intervention and they own it and they embrace it, meaning that even financing will become easy when there is a breakage and in for example a borehole, and it can be fixed by themselves using the available resources. They are able to fundraise without even first coming back to the donor or to the organization that gave them such a borehole. So that's why involvement of these people is very essential in making sure that we have sustainability, and in this case sustainable financing mechanisms. Then, so how can we improve wash in South Sudan? So improving wash in South Sudan will be crucial for improving health outcomes and promoting development, and a collaborative approach involving the government, NGOs, local communities is very essential to achieve sustainable development of wash services in South Sudan. So, for us to achieve good wash practices in South Sudan, we need everyone on board. We need the NGOs that are already doing a good work. We need the government to support them as well. But most importantly, we need the local communities to embrace whatever is being provided and then uh, make sure that they own it so that these uh, interventions or this wash is sustainable, so that we can have a better livelihood in South Sudan, so that we can be more productive. We are not having fecal oral diseases. We are not students are not missing classes because they fear of sharing latrines with people of the opposite sex. They do not have where to dispose of their used menstrual towels. So they fear of going to a place where there is no safe drinking water. So all this can be achieved when we have everyone on board: the government, the NGOs or the non-government organizations, and the local communities, and of course us as public health practitioners need to play a very good role in coordinating all these people so that we can achieve the desired situation in our beloved country, South Sudan. So thank you so much, and I want to wish you a good evening.